Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of amoebic liver abscess. So, for the treatment, we have for the treatment of amoebic liver abscess, we can give an antibiotic is the main important treatment, which is metronidazole is given in the dosage of 750 milligrams daily for TDS, that is thrice daily for 10 to 14 days. We give metronidazole. This is the drug of choice for amoebic liver abscess, and this is actually curative in over 90% of cases. And this metronidazole, once you give metronidazole, clinical improvement is seen within 3 days of giving this metronidazole. So this is the best treatment which is available for treatment of amoebic liver abscess. Then we can also give luminal agents can also be given for amoebic liver abscess. So in the amoebic liver abscess, luminal agents can be given, especially luminal agents like idoquinol, paramomycin and diloxanide furoate can be given to the patient. And average time for radiological resolution in the abscess. So if you see, the radiological resolution in the abscess occurs by 3 to 9 months of time. Okay, then that is one thing. Okay, for if you give the antibiotic treatment, and in certain cases we can even do aspiration of amoebic liver abscess. So when do you do aspiration in amoebic liver abscess? In amoebic liver abscess, aspiration is mainly indicated if there are 6 indications. One, if the diagnosis is uncertainty, when we are not sure what the diagnosis is, whether it is an amoebic liver abscess or whether it is an pyogenic liver abscess or whether it is something else. So for the diagnostic certainty, for finding out what the diagnosis is, we can do aspiration. Then, second, you have given the metronidazole drug and you give it for 10 to 14 days. But within 3 days, you should see clinical improvement with metronidazole. But now you have given the drug metronidazole for 3 to 5 days. But still the patient is not responding. There is failure to respond to therapy in 3 to 5 days. Then definitely you should aspirate the patient. Aspirate the abscess. Then, if the patient has pyogenic superinfection, then you should do aspiration. Then if there is high risk of rupture, there is high risk of rupture is present whenever if the size of the cyst is more than 5 centimeters, or if the abscess is present on the left lobe, then there is increased chances of rupture. So if there is increased chances of a rupture, then it is better to do a aspiration. In pregnancy, we have to do aspiration.
thank you and thank you for watching.